guys, welcome back to the Tooth Be Told podcast. My name is Brandy. I am a registered dental hygienist with a local anesthesia permit, and I have been practicing in the dental field for the last 20 years. If this is your first time joining us, our podcast is focused on providing the underserved and underprivileged communities, particularly communities of color, with the knowledge, tools, resources, and information to help improve their dental health care experience. So, guys, today we are going to talk about teeth whitening. This is huge. So many people come in and want to have a whiter, brighter smile. So, I'm going to talk quickly about the options, about the pros and cons, the price, and how it actually all works. So, we'll do that now. So, how does whitening work? Whitening works by a chemical oxidation reaction. So, it's a chemical reaction where hydrogen peroxide more than likely is going to penetrate the tooth surface to remove stains from inside of the tooth. So whitening is targeting the stains that are inside of your teeth. And if you have any surface stains, those should be removed during a regular dental cleaning. You should be able to have those removed then. So whitening is also known as bleaching. So you may hear at your dentist's office, you want to bleach your teeth. So bleaching and whitening are one and the same, just so you understand. So there are several options. So I'll start with the one that costs the least. So there are whitening toothpaste. So whenever you see a whitening toothpaste, understand that the whitening you're going to see may be minimum to none. There is only 1% hydrogen peroxide and maybe a little bit more in some toothpaste, but the whitening effect is not going to be very much. So if you're using a whitening toothpaste, just keep that in mind that you're not going to see a super bright white smile, even if you're using it over a period of time. And then you have like over the counter options. So there's like your whitening strips, there are tray systems, gels or gel pens. So these are going to be a little bit higher in hydrogen peroxide percentage. So probably like 3 to 7. Um, so you may see some improvement with something like that if you just want to do something over the counter without having to go to your dentist. So that might be helpful. Some of my patients, they find success with those. And if you're going to your dentist, they do have take-home options as well. So there are tray systems that are already pre-made that have the bleaching material inside of the trays already that are disposable that you can wear. There's also custom trays, which are made specifically for you. So with the custom trays, they take molds of your teeth and then they make the trays for you. Those trays you'll keep forever, and then you'll just continue to purchase the bleaching syringes. So that's the whitening material that comes in a syringe. You fill up the trays, you wear the trays, and then you keep them so they're not disposable. So that way you're just buying the bleaching material over and over instead of having trays to buy over and over. So that option is probably a little bit more costly. And then, of course, they have the in office whitening. So something similar to Zoom, where there's a light system used, and you're having that done by your dental professional, either your hygienist or your dentist will do that. And usually it's about an hour appointment. They usually break up the sessions. So you might have 3 20-minute sessions with the whitening and the light system. So those are the main whitening systems. So now I'm going to break down the cost for those and then also the risk and benefits for each. I'm sorry, I forgot to mention there's some people who like all natural whitening or holistic whitening. So the only thing I can say that you can try is like baking soda or hydrogen peroxide on its own. Now, hydrogen peroxide in the brown bottle, 3%, is phenomenal for killing aggressive bacteria. So I use it as a mouth rinse. I cut it with water. So 3/4 water to a quarter hydrogen peroxide. So that's good as a mouth rinse. Some people swear by it for whitening. It's only 3%, but you can try to do that. It's okay to do several times a week anyway, even if you're just using it as a mouth rinse. And then the problem that I have with baking soda is that it's very gritty. So it's not something I would recommend to use on a day-to-day basis, because over time, the heavy grit of the baking soda can kind of wear away at the enamel and make the teeth way more sensitive. So, but there's some patients of mine who really like using the baking soda and the hydrogen peroxide for that reason. There are also patients that use that activated black charcoal. That I do not recommend, because when I see patients back after they've been using that, there's black line stain inside their mouth. I mean, it is black. So it stains black. And even if you can't see it on the outside, I can see it on the inside. And it's not easy to remove. So I don't recommend the charcoal, also because it's very gritty as well, and it also can kind of make the enamel sensitive over time and kind of wear away at it. So I would stay away from the charcoal and just use the baking soda and hydrogen peroxide with caution as well. Okay, so if you are going to opt to have any whitening done in office, whether that is a custom tray that we make for you to take home and keep, or whether it is the light system similar to Zoom or Zoom itself that we do in the office, just keep in mind some of the risk for whitening in general is tooth sensitivity and gum sensitivity. So the whitening can make the teeth and the gums very sensitive. It is short lived, so it's not something that you're going to experience every day after, but at least that first day or second day, you can be very sensitive, especially if you're having the in office treatment done. That tends to make patients extremely sensitive. And so some people who have gotten it done decide not to do it again. So it's just something to keep in mind. Um, and if you are going to do it, a good thing that you can do afterwards is to use a heavily fluoridated toothpaste. So you may want to ask your dentist to prescribe you a prescription strength toothpaste with fluoride, because that may help with the sensitivity as well. So that's the main thing. And then your gums also may be sensitive because the bleaching material, the hydrogen peroxide, can actually not only be abrasive to the gums, but it can burn the gums because it's hydrogen peroxide. And so you have to be very careful when using it. Just follow instructions. When we're in the office, we take precautions to make sure your gums are protected. But just keep that in mind. Those are two things. Also, if you plan on having any restorative treatment, so any white fillings, bridges, crowns, implant crowns, or if you want to match partial dentures or flippers to your existing teeth, always, always, always bleach your teeth or whiten your teeth before your dentist picks a shade for your crown, or before they pick a shade for doing white fillings on your teeth. The reason why is that your restorations or your fillings, crowns, etc., they will not bleach. So, for instance, if your two front teeth have caps or crowns on them and you want to whiten, just take caution, because they are not going to change color, but the teeth surrounding them will. So it may make them stick out more and it may not look how you want it to look. So same thing as if you have fillings on front teeth, you're going to have that same issue. Or if you're wearing, just say a partial denture or a flipper, which they won't change color either. So I just want to put that out there, because a lot of people don't get that. They want to whiten their teeth, and some of them think that crowns can be whitened, but once the shade is picked for them, they are picked. So if you're having any restorative work done in the future and you want your teeth whiter, whiten them before. That way, when you whiten again in the future, when you get light, you'll match those crowns or fillings or whatever the case might be. Another thing is that if you're going to whiten, it is best to do it after you have your teeth clean. First of all, we want to remove all that plaque, the tartar, the debris, and any stain on the surface of the teeth. So we want to remove all that. It's best to do it that day. So the reason why I say that is because when we polish at the end, The polishing toothpaste is very gritty, and it kind of opens up the tubules in the tooth so that whatever you put on the tooth at that point, it will uptake into the tooth. So, for instance, if I polish someone's teeth and get all of the plaque off, then I can put a fluoride treatment on and it's going to suck up the fluoride treatment. Or if we do a bleaching, it will suck up the bleaching material and it will help to whiten the teeth much more. Um, and another tip is if you are going to whiten the day of the whitening or the day after, do not eat foods that stain your teeth. So, or drink any beverages. So, no coffee, no tea, red wine, any kind of like blueberries, anything that's heavily pigmented, because also, just like we were saying, the tubules are open and it's going to uptake into the tooth. So, I would not drink any tea or coffee the day of or the day after you have whitening done because you're not going to have a great result. The cost of the whitening can range from $300 to $1,000. Now, that's specifically talking about the in office bleaching, the in office whitening, the light system that is done by your dental professional. So keep that in mind. For your over the counter options, you should be able to find, I would say, maybe $20 to $50, depending on what you want to do. I know in my office, we charge $500 for the in office whitening. And then for the take home trays, it's $69. And then if you want to have trays made specifically for you, the custom trays, that is $200 where we take molds of your teeth. So you're going to have a range depending on what office you go to, what facility. So you can just call and check ahead of time. If you're already a patient somewhere, you can just find out from them. And the last thing I want to mention is that um, there is a threshold to whitening. So, what I mean by that is not everybody is going to bleach the same. You're not going to have the same outcome. So, just because you're bleaching doesn't mean your teeth are going to be chiclet white. And to be quite honest, you don't want them to look like that because it doesn't look natural. Teeth naturally have a hue. So, looking really, really, really white looks strange, but also not everybody's going to have that result. So if it were me, I would start with something that is on the more affordable end first to see how you respond to whitening. If you whiten very well and you see a very good result, but you still want something more than what the whitening treatment you're using at that point can give you, then I would seek probably a more professional whitening at that point. So it's all up to you, but play around with it. I would probably do something like over the counter first just to see how that works because you don't want to spend a ton of money and not get the result you want. Um, Lastly, the whitening is something you're going to continue to do. It's not a one and done thing. It'll be maintained. So what I mean by that is you'll probably do it every time you feel like your teeth are getting dull again, or you want to brighten them, or they look like they're getting stained. The reason for that is just that you're eating and drinking every single day, and those things that you eat and drink, of course, is what causes the stain. Or if you're smoking or something like that, all of that causes the stain, and it's going to continue to happen as long as you're doing those things. So just keep in mind that this is something you would get done from time to time. Some of my patients do it a couple times a year. So it just depends on what you're looking for and what you want your result to be. So I just wanted to talk to you guys about that because I've been having some questions via email about whitening. If you guys have any more questions, please hit me up at truthbetoldpodcast@gmail.com or in the comment section. And I look forward to talking to you guys soon. Enjoy the rest of your day. Bye.